For joining us here today. I've been traveling Michigan throughout the last year as a candidate to be the next governor of Michigan, and no exaggeration, every stop from Iron River in the Upper Peninsula to here in Detroit to Flint to Muskegon, every stop, Michiganders have shared heart-wrenching stories about a broken, unfair, inaccessible, and increasingly unaffordable healthcare system. And it's risen to the top of every conversation. Just the other week, my friend, State Representative Betsy Kofia, shared a heartbreaking story with me about a woman in her district in Traverse City that underscores what so many Michigan residents are facing today. The resident shared with her that she could not even afford the bootstrap that she's supposed to pull herself up with. She said because the cost of healthcare is taking all she has. In her case, she and her husband did everything right, worked their entire lives, paid their taxes, bought a home, haven't even used a credit card in 20 years because they didn't want to run up debt. And yet, over the course of the last year, her family spent $50,000 on healthcare. The cost to get dentures with dental insurance was $35,000 out of pocket. And as a result, their retirement savings is gone. And she felt, in her words, deflated. And I could tell she felt completely abandoned by those leaders who were supposed to stand with her and help her and be on her side. And I see and hear those stories all across our state. This is what our healthcare system is doing to families across Michigan. It is crushing the hope of the people who have played by all the rules, who are working to live within their means, and who still worry every day that they are just one major injury or illness away from bankruptcy. So, as leaders in Michigan, we have a moral responsibility to fix this. I hear so much about this every day, and it's clear to me that it will be the defining issue of 2026. And I know deeply that one of the most significant things the next governor must do is ensure that healthcare is affordable, is accessible, and fair for everyone, no matter of anyone's income or their zip code. So while other candidates cast votes over and over to raise healthcare premiums on our residents, I am here as a candidate who has an actual plan to fix this broken healthcare system here in Michigan. And here it is. I'll start with the first pillar of our plan, affordability. Right now, health insurance can cost over $27,000 for a family of four. And a significant reason why health insurance premiums and costs are on the rise is because of the skyrocketing cost of prescription drugs. Right now, there are no limits on how much the pharmaceutical manufacturers can charge for these drugs in Michigan, and we're going to change that. I will empower Michigan's Department of Health and Human Services to demand transparency for consumers and help inform health insurers and the state's Medicaid program on the best ways to limit medication costs. And in my first 100 days as governor, I will establish a healthcare affordability board that will bring together healthcare providers and patients to examine costs and continuously find ways to reduce them. The board will be charged with examining the overall cost of healthcare and identifying continuous ways to reduce those costs while increasing the fairness and transparency of the system. 12 states already have these boards, and Michigan will be next. Finally, we're going to relieve the burden of medical debt. I will empower MDHHS to implement effective debt forgiveness programs, increase access to financial counseling, and partner with hospitals to limit aggressive collections that will ensure patients are treated with dignity. The second pillar of our plan is accessibility. Now, as Secretary of State, I transformed our state's second largest agency to be service-driven, saving residents time and money and making their lives easier. Now, I want to make all of state government work that well, starting with Michigan's largest state agency, the Department of Health and Human Services. Right now, the agency is too complicated, outdated, and disconnected from the people it serves. I will work to transform it using the same data-driven, people-centered approach that revolutionized our agency. For example, where federal changes are creating more burdens for residents to get access to Medicaid and other provisions, I will ensure MDHHS works with patients and providers to make it as easy and seamless as possible for Michigan residents to access their medical coverage and support. That means also building an internal infrastructure that will use all the data that we already have as a state to ensure eligible Michiganders can keep their Medicaid or SNAP access without having to jump through additional hoops, fill out additional duplicate forms, and overall engage in an inefficient process. We already have a lot of the information that we need to determine people's eligibility at the state. We're going to use that data to ensure we're meeting people where they are and providing that care. We're also going to fund navigators and community health workers to proactively reach out to people who are on the cusp of enrollment to help them stay enrolled and navigate complex choices they may have. We're going to be a helping hand, not an obstacle course. We'll also bring mobile health centers to underserved communities. We want to support healthcare workforce development by investing in a new generation of nurses and physicians to make it easier and more affordable for those physicians and nurses to serve in our state and get access to the education they need to provide those health benefits. And we'll also address the maternal health crisis, particularly for Black mothers who deserve culturally competent care. And more details on all of that, Alyssa can get you in the plan that we're releasing today. The third pillar I want to get to is fairness. We need to ensure that medical decisions are based on transparent data and presented in ways that people can actually understand. That means we've got to use technology to help people also appeal unfair healthcare coverage determinations made by insurance agencies. Because healthcare decisions are too often being made by agencies in a profit-driven way, not between doctors and patients in a healthcare-driven way. We need to change that, and we can do that by helping patients appeal unfair decisions and ensure that we are on the side of residents and patients as they seek to navigate through complicated healthcare coverage determinations. We also need to talk about long-term care. Michigan is now one of the oldest states in the country. 25% of our population is on Medicare, and that's only growing. So it was only 14% a decade ago, and it's going to grow to even more in the decade ahead. So we're facing what some call a senior tsunami, and caregivers need support. So we're going to expand counseling services for seniors and provide a $5,000 caregiver tax credit. Just like childcare is critical for working families, caregiver support is essential for families caring for aging loved ones. The bottom line for me is this: the next governor of Michigan must be prepared on day one to leverage every tool in the toolbox to ensure healthcare is affordable, accessible, and fair in our state. And I not only have a plan to do that, I have the experience necessary to transform state government to get this done. I want to turn it over to my friend, State Representative Jimmie Wilson, who's also here today. But before I do, I just want to close with something that happened to me over the summer that really underscored to me the necessity and the urgency of fixing this broken system. I was in a running community in Detroit over the summer and joined them one morning, and someone came up to me along the run and shared with me that she voted for Donald Trump for president and wanted to know if I had a few minutes to listen to her story. And I thought, sure, I'm looking forward to hearing about your decision to vote for Trump and how you feel about that. But that's not the story she told. She told me a story about how her father worked as a carpenter his entire life, and every month he made monthly payments into a healthcare system without fail. And in the last few years, he developed severe heart troubles. And a few months prior to this conversation, he had suffered a heart attack. He survived that heart attack, but required additional care afterwards. And his health insurance company that he had paid into for decades denied that additional care. As a result of that denial of care, he sadly lost his life a few weeks later, and just before our conversation had happened. The young lady shared with me that her dad did everything right. He played by the rules, he paid his bills. When he needed help, no one would help him, and he lost his life because of it. That to me is unacceptable. And I will never forget that she turned to me at the end and said, all I'm asking for you, as someone who seeks to lead this state, is that you remember my dad's story and that you do something to make sure that the people of Michigan get healthcare when they need it. That's all I ask. That stuck with me, and it has stuck with me every day since, and has only been bolstered by countless other stories I've heard like that are tragic and that convince me, and it's why we're here today, that as governor, I will have a moral responsibility to address this failed system. Because when families are denied coverage at their most vulnerable moment, when the system fails, when people need help the most, that's not just an administrative failure, it is a moral failure and an abdication of our job as leaders in Michigan, and it has to stop. So I plan to be a governor to ensure the woman I mentioned in Traverse City, the woman I met in Detroit, her family, the thousands of families that, like them, get the health care they deserve. And they get leaders who will listen, fight, and not rest until we get this right. I'm that leader, and so is my good friend, Representative Jimmie Wilson, who's also here to share his commitment to this work as well. Jimmie, I'll hand it over to you.
You, Secretary Benson, and to those who are here, you can hear the empathy. That's what we need in our next governor, and that's why I want to talk to you about Jocelyn Benson's healthcare plan and why it matters. It's not just a policy; but it's a promise to Michigan families who are being crushed by a system that's failing them. Jocelyn's plan is built around three simple but powerful pillars: making healthcare affordable, accessible, and fair. She's going to tackle prescription drug costs that are driving insurance premiums through the roof. She's going to reform the Michigan Department of Health and Human Services using the same approach that transformed the Secretary of State's office. She's going to relieve medical debt and fight for a consumer bill of rights so that patients, not insurance companies, are making medical decisions. And she's going to address long-term care for our aging population with real support for caregivers, including a $5,000 tax credit. This is the comprehensive, bold leadership that Michigan needs. But let's be clear about what we're up against. We have other candidates like Congressman John James, who has voted several times over the past few months to raise our health care cost. He voted to take health care away from people. When Michigan families needed someone to fight for their coverage, he sided with those who wanted to strip it away. That's not leadership, that's abandonment. And to the other guy, Mike Duggan, he said Medicaid costs are not as bad as they look, the Medicaid cuts. Let that sink in. The Medicaid cuts are not as bad as they look. Tell that to the woman that Jocelyn met in Detroit, whose father couldn't get care for his heart condition because they couldn't afford the premiums. Tell that to the hundreds of thousands of Michiganders at risk of losing coverage. Medicaid cuts don't matter. That's out of touch and it's dangerous. We need a governor who understands that healthcare isn't some abstract policy debate. It's about whether families can afford to see a doctor. It's about whether our neighbors can get their prescriptions. It's about whether someone's parent gets the care they need or gets turned away. We need a governor who will make healthcare, which is one of the top issues facing us right now around the country and here in Michigan, an actual priority. Not a talking point, a priority. That's Jocelyn Benson. She's shown us what transformational leadership looks like at the Secretary of State's office. She's listened to families across this state, Republicans and Democrats alike, who just needed someone to hear their struggles. And she's put forward a real plan to fix this broken system. Affordable, accessible, fair. That's not just a mantra. That's a commitment to every Michigan family that's choosing between prescriptions and groceries, between care and bankruptcy. So when you hear someone say Medicaid cuts don't matter, remember that woman from Traverse City who's feeling deflated. When you see politicians voting to strip away health care, remember that father who had the heart troubles, who was denied care. And remember that we have a choice. We can keep electing leaders who don't understand or don't care about healthcare crisis that are facing working families, or we can elect Jocelyn Benson, someone who will fight for us, listen to us, and deliver real solutions. That's the choice in 2026, and I know which side I'm on, and I thank you for being here today. It gives me great pleasure to turn everything else over to Dr. Asia Harris.
Thank you. Thank you. Good morning, everyone. My name is Dr. Asia Harris, and I am a family medicine doctor here in Flint, Michigan. I'm happy to be here to talk to you about why I'm supporting Jocelyn Benson's healthcare plan, not as a political statement, but as a medical one. Every day in my practice, I see the consequences of the healthcare system that's broken. I see patients who can't afford their medications that I prescribe. I see families delaying care because they're terrified of the cost. I see the devastating disparities in maternal health outcomes, particularly in Black mothers, that should be unacceptable in a state like Michigan. What struck me about Jocelyn's plan is that it's clear she listened, really listened to healthcare providers, to patients, to the communities that we serve. This isn't a political document. It's a practical roadmap built on what we know actually works. Let me talk about two parts of this plan that matter deeply to me as a physician. First is the Prescription Drug Affordability Board. Right now, I have to have conversations with patients that no doctor should have to have. I prescribe a medicine that could save their life or manage their chronic condition, and they look at me and say, I can't afford that. We try and find alternatives. We apply for the assistance programs out there. Sometimes we just watch as they go without their medications. Health insurance for a family of four can cost over $27,000. And a huge driver for that cost is prescription drugs with no limits on what pharmaceutical manufacturers can charge. A prescription drug affordability board brings together providers and consumers to examine these costs and find ways to reduce them. 12 states are already have these boards, and the data shows that they work. They create transparency, they help insurers and Medicaid programs make informed decisions, and they put downward pressure on the cost that is bankrupting families. As a physician, I want to practice medicine, not financial counseling. This board will let me focus on what's best for my patient's health, not what's realistic for their bank account. Second, addressing the Black maternal health crisis. The statistics are staggering and shameful. Black mothers in America are 2 to 3 times more likely to die from pregnancy-related complications than white mothers. This is about systemic failures in how we provide care. Jocelyn's plan fights to invest in culturally competent care, Medicaid-covered doula and midwife services, and mandatory bias training for maternal health providers. As physicians, we take an oath to do no harm. But if we're not addressing the implicit biases and systemic barriers that lead to these disparities, we're failing that oath. We need leadership that understands that it isn't just a healthcare issue, it's a justice issue. The plan also calls for better access to prenatal and postpartum care and partnerships with community organizations. This is how you actually change outcomes, by meeting mothers where they are and providing comprehensive, respectful care throughout their pregnancy journey. Many candidates will release a healthcare plan with no mention of Black maternal health care. Her putting this in her first draft of her agenda will be meaningful to many communities impacted by the maternal health crisis we're facing. Here's what I want people to understand. We need a healthcare-focused governor in office, someone who sees healthcare not as a budget line item, but as foundational to Michigan's future. Someone who will prioritize the health and well-being of our communities. This plan is comprehensive. It's evidence-based. It's built on real solutions: affordability boards, maternal health investments, MDHHS reform, support for caregivers, mobile health centers, and workforce development. As a physician, I can diagnose problems. I can prescribe treatments, but I can't fix a broken system alone. That takes political will and courageous leadership. So I want to thank you, Jocelyn, for putting this together and being the first candidate to show that this is a serious issue for the next governor to take on. I'm worried, really worried about what's happening at the federal level, and this plan could be a guardrail we need. Thank you. Now I'll pass it on to Alyssa.